patient develops sympathetic ophthalmitis after a penetrating eye injury. What type of inflammation is typically seen? Right answer is option D, panuveitis. Sympathetic ophthalmitis causes inflammation involving the entire uveal tract. Therefore, it presents as panuveitis. Which of the following genetic disorders is inherited in an autosomal recessive pattern? Here the right answer is option B, cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder, which means the child usually inherits one faulty gene from each parent. A patient develops hemolytic anemia after taking primaquine for malaria. Deficiency of which pathway is most likely responsible? Right answer is option C, HMP pathway. Primaquine can cause hemolysis in G6PD deficiency. G6PD is an important enzyme of the HMP pathway which protects RBCs from oxidative damage. After surgery for varicose veins, a patient develops loss of sensation over the inner side of the leg and foot. Which nerve was most likely injured? Right answer is option B, saphenous nerve. The saphenous nerve supplies sensation to the medial side of the leg and foot. It can be injured during varicose vein surgery. A febrile patient has a widespread rash that sprays the palms and soles. Body lice are found on examination. Which organism is most likely responsible? Right answer is option C, Rickettsia prowazekii. Rickettsia prowazekii causes epidemic typhus and is transmitted by body lice. The rash typically spares the palms and soles. A microfilaria has a sheath and shows two distinct nuclei at the tip of its tail. Which parasite is most likely? Right answer is option B, Brugia malayi. Brugia malayi has a sheathed microfilaria with two nuclei at the tail tip. This is an important identifying feature of Brugia malayi. Which finding best indicates that an infant is growing normally during the first year of life? Right answer is option C, length increases by about 25 cm during the first year. A healthy infant's length increases by about 25 cm during the first year. This steady increase is a useful indicator of normal growth. A 10-year-old child weighing 30 kg has severe dehydration, blood sugar of 550 mg per dl and pH 7.01. What is the initial management according to ISPAD guidelines? Right answer is option C, ABC management plus NS 20 ml per kg, then start insulin after 1 hour. In pediatric diabetic ketoacidosis with severe dehydration, fluid resuscitation comes first, give normal saline and start insulin after about 1 hour of fluids. Which autopsy technique involves removing the organs together as one complete mass from the tongue to the pelvis? Right answer is option B, Letulle technique, which means all the thoracic, abdominal and pelvic organs are removed together as one single mass, and it is also called the en-masse method of autopsy. A child eats fruit from a garden and later develops high fever, confusion, photophobia and difficulty passing urine. Which poisoning is most likely and what is the antidote? Right answer is option D, Datura Poisoning. Datura causes anticholinergic poisoning, leading to confusion, fever, photophobia, and urinary retention. Physostigmine is the antidote for severe toxicity.